Welcome everybody to today's FAQ session. For most people, I think that have dialed in already, most of you guys we've met before. I've just got nicely acquainted with a couple of people who we haven't met yet, but just in case, I'm Mel Spooner. I'm going to hand over to my colleague, Education Director, Dr. Carl Robertson at CAWS, to talk through the first couple of slides, which are just going to frame up what we're going to talk about today, just a little.
Okay, hi folks, yeah, my name is Colin Robertson, and really I kind of spend most of my time in the research around what's happening, particularly with regards to what's occurred in the past 6 months with regards to COVID-19. And all of that's been focused on developing and preparing now how our industry can, deal with the circumstances as they start to roll out from this point forward. Most places now have been kind of operational for the past 2 weeks. In fact, when we did the talk with UK Active, it was the day before the gyms got to reopen. So there was a fair bit of interest at that point, and there's been a lot since. And now I think people are starting to open the doors, find out what it's like and what's coming their way. But I would say to you that this still isn't what normality is, not what it was, but also as to what we're heading into. So we're not preparing the workforce because lockdown has eased. That's not really what it's about. And it's really important to recognize that the reality is within the UK, in fact, within most parts of the world, most people still don't know someone who's had COVID-19. And that's because of the current numbers and statistics. Some of you guys on the call today may well have done. I certainly do. And I know Mel has. Part of the reason why I do is because of what I do for a living. So it's unavoidable for me. But the fact is that for a lot of people, it's still intangible. It's still such an unknown. So it's really about getting people to think about, well, what is that person like who's had COVID-19? And also to get people to start to recognize most people do not die of COVID-19. And this is what we're getting browbeaten with through the media. And I understand that because this is the starkest, the harshest reality of what COVID-19 has brought to the world is the deaths. However, it's about the vast majority of people who are going to experience COVID-19 at some level with regards to the severity and the duration of those symptoms and what needs to be done in the wake of that. And this is why it's really important that we do our best to stay up to date, because COVID-19 is a novel virus. And I can assure you, I'm in research groups that's related, directly tapped into the Leverhulme at University of Oxford, working across Greater Manchester as a whole district with health innovations, and globally. We are finding out new things about COVID-19 on a daily basis. And you've only got to go back and have a look, because it's publicly shared information, and look just how much of our understanding has been shaped since March with regards to how the acceleration has been on investigating this and researching it. It's a novel virus. It doesn't behave like any other virus. There are fundamental things that are different about it, and we're learning more all the time. So with that, we've got a very kind of live curricula that lends itself to being updated as we find out more. But right now, as today, we know that we are going into unknown territory, but there are lots of facets of understanding that we can take on things that we've worked around before. I really do want to stress this is not something that we're looking at getting past in any time soon. We're not going to raise a glass at Christmas and go, wasn't 2020 crazy with COVID-19? We're still going to be in the thick of it. We're still going to be pushing towards the far side and leading out for at least another 12 months. And the reality is we're looking, really estimating towards 2023 as to when we might start to say, because of the impact of vaccine, because of the impact of people's immunity development and better understanding, or the measures that we can start to make that road be on the side of it. And the way to consider that, before we get into the crux of it really, is if a person today realized that they were symptomatic with COVID-19 and then they endure their symptoms for just 7 days, so they have a very mild experience of it. Then there's 14 days in which they're going to be isolated, and they're not going to, have any kind of contact just to limit the risk of spread of infection. And then they're going to start to look at when they might start to re-engage, or for the first time engage in physical activity and exercise to improve their situation. So from that point, which is arguably 3 to 4 weeks from this point, at the shortest, they're going to start to take a 24-week, 30-week journey out of it. And that's just one person who found out today. There are thousands of people waiting in the queue, and there are thousands of people more who are going to become symptomatic as we go through the remainder of this year. So if we just look at it on those terms, we are going to be supporting and working with people who've had COVID-19 for a fair while to come. NHS community rehab, which I'm a fan of and I'm directly tapped into, cannot serve millions. If they could, they would. They'd be doing it already. They would already have an infrastructure that help people with back pain, cardiovascular rehabilitation, pulmonary rehab, cancer, type 2 diabetes, and they don't. And the reason being is that there is no capacity to facilitate this on a national scale, dealing with an entire population. But we do have the infrastructure. We are based in society and in the communities. That's where our business takes place. That's where our gyms are. And we have the skill set, the knowledge, the understanding, and the expertise to not only rehabilitate people effectively from something like this, once they get past the acute phase, and then also to manage that for the rest of their life, to give them a quality of life and put them in a better position as they go down the journey of their life. What we're trying to do is not to replace clinical rehabilitation or community rehab. They're essential, particularly for someone who's been hospitalized because of COVID-19. Our task is at the point that they leave there, they're given the all clear. Our task then is to work with that person to do the rest of their rehabilitation, restoration, and put them better aligned to health outcomes again for the rest of their life. Looking at the government's latest obesity agenda, it's the same agenda under a different name. The previous government put 75 million into it. This government is pledging 10 million into it. I welcome anyone who wants to discuss obesity and how we can tackle it. Obesity is a clear sign indicator of a person's potential risk to develop a chronic disease or illness. It is in itself a limiting factor with regards to health. So I'm all for it. How that's going to be implemented and operationalized, as ever, history has taught us, is up for debate. But the good thing is, I believe, with this latest agenda, is it empowers us as health and fitness practitioners to get past this conversation and this dialogue around aesthetics and confidence versus health and ability, because they're two separate components. We know that with increased levels of obesity come increased levels of risk. So we know that one of the prime things we can work on is facilitating that with regards to changes in lifestyle, looking at nutritional factors, physical activity, and exercise. So this all fits well within our skill set as to what we can do for the long term. I'm not going to read through all this. The whole point of this slide is please do have a read. You may well be up to speed with the statistics anyway. Most of the leading experts say that we've never come out the first wave. That the first wave has just kind of rolled a little bit and has grumbled along, and it's going to take us headlong into the second wave. If you look at any voice of reason, understand their expertise, that is their take on it, and I would have to agree. Since we did our talk a couple of weeks ago, on the Friday before the gyms reopened, you can see the statistics there for what's progressed and what's changed. None of it makes for particularly fond reading. So we know the situation is happening around us. It hasn't stopped, it hasn't slowed down, it is continuing. So as I said earlier on, because of that, this is something we are going to be picking up and working with individuals and groups for months and months, in fact, years to come.
Okay, so hopefully everybody has had an opportunity to download the FAQs doc that accompanied the webinar link, which details a host of questions broken down into various categories, some of which we're going to address together today. We should point out that the list was compiled not purely based on our opinion and our thinking. We collected the questions from people who are working on the front line, from conversations that we've had ourselves with people who've endured COVID-19, from people in clinical practice, sports science, sports medicine. So we've pulled together that expertise to formulate these FAQs. The chances are strong that we would never be able to get through that list of FAQs in one day, in one call together, possibly not even one day in fairness, but in one call. So what we've done is thank you to those guys who sent us a message in advance to say particularly which questions they would like to cover most. So we've picked out about 5 or 6 that seem to be the recurring topics. So we'll make sure that we do cover those together. We'll rattle through those questions, and then there is going to be a bit of a juncture then for any new questions that you guys may want to talk about today. And as promised, we'll get through as much as we can. Just before that though, just to provide a tiny little bit of context to what we're talking about, and there are a couple of people signed in. I know Alex for sure, for example, who were on our last call with UK Active, that's seen this video, and a few people have seen this video as it's been shared by UK Active on LinkedIn and so on. But it helps to sort of encompass a little bit of what Col said and frame up some of what's to come in the rest of the call. If you have seen the video before, apologies, use this opportunity to top your brew up, nip to the loo. But otherwise, I'll leave this with you for a couple of moments.
It's called a novel virus, which means it's new to all of us.
Hi, my name is Charlie Peters. I'm 30 years old and I'm currently living in northwest London. I'm a professional Muay Thai fighter with over 13 years experience, but I'm currently transitioning over into endurance training. I'm working my way to a half Ironman later this year. I've had 67 professional Muay Thai fights, former 3-time world champion and the current UK #1. So I work at various gyms around London, taking group fitness, as well as personal training individuals to teach them boxing or Muay Thai. I cycle quite a lot around London and I'm always on my feet, walking anywhere and everywhere that I can. So I'm very, very active. So I got COVID.
I was having my 60th birthday on the 3rd of April. And so from the beginning of January up until then, I was on a mission, and I was absolutely determined I wasn't going to hit 60 feeling less than my best self. So, you know, swinging 16K kettlebells and running around and doing all sorts of, and bouncing about, feeling as fit as a fit thing. I got back down to my fighting weight. I went to the supermarket at 7 a.m. and I think I got it there.
Hi, I'm Kate. I'm 38 from Warwickshire. I contracted COVID around mid-March. I'm now 19 weeks post-COVID.
So one thing I remember clearly from COVID is feeling how fatigued I was. I literally didn't do anything all day, but I just felt exhausted.
It's knowing what fatigue is different to tiredness. I felt absolutely fatigued, absolutely completely wiped out. Breathless going upstairs, total fatigue, absolutely wiped me out.
My initial symptoms were very flu-like and lasted only around a week. But the hardest part of it was the 3 weeks after that. And I really did feel super fatigued, really struggled actually to go about my daily business. And that was quite difficult. I'm an at-home mum of 2. There was a moment where I was quite afraid. The effort on my lungs was quite intense.
But I noticed my heart rate just shoot up. And even if I tried to run really slowly, my heart rate would stay high. I've done a lot of sprint work. Heart rate is a clear indication of how much stress the body's taking. That's when I knew something was quite serious. I was more so frustrated mentally. You know, I'm so fortunate that, you know, I've been okay.
My heart doesn't skip a beat normally, but I could feel my heart thudding in my chest. and I felt fatigued for 2 or 3 days afterwards. My neck I could feel my pulse in my neck. My head felt it was going to explode. After that, that took me really downhill.
Maybe I trained 4 times, maybe 5 times a week before. I do a lot of resistance work, mainly circuit-based. If I do any cardio, it is mainly on the biking side. Initially, just getting back on the biking side was really, really difficult, and I couldn't maintain long sessions.
So clearly I'm not unusual. There's quite a lot of people who are going down that road. All consuming, and just to walk downstairs and get a cup of tea was exhausting. And by the way, during the night, I've had this really, really weird pain in my head, and my cheek feels numb. And she just said, you've got to get an ambulance and get yourself to hospital quick, because you might be having a stroke or have had a stroke. They've said I've got some mild neurological nerve damage. If you go to a class and say, right, well, we're going to do an EMOM, every minute on the minute. I don't think my brain could actually process that as well at the moment. I'm really scared to start again, because I don't know whether it's going to trigger it off all over again. But I don't want to not start again, because I want to get back to myself. But I don't know when the right time will be to start.
It's not really how much you do. I think it's probably short and steady wins the race with this kind of thing.
So that can be as simple as a 5-minute walk on a treadmill, and at a given pace, at a given kind of incline, and it's just see how the body responds, and almost
try and figure out what kind of resources we need, what kind of testing we need, what kind of staff we'd need.
So at least I'd say about 8 to 10 weeks since I've been feeling better. You get to learn your body in a different way, in a different manner. My body's never been through something like that. I've never been through it mentally and physically. So I feel like I've learned a lot more about myself. I've been extremely lucky. I've been extremely, extremely lucky. What you learn about yourself going through a battle like that is an amazing thing to happen. But I've been very fortunate and very lucky in comparison to many other people. So my thoughts are with them, definitely.
Because it never stops. It never bottomed out. Without a vaccine, we are looking at a very different world for the next 2 or 3 years.
We need a new normal for everything, don't we?
So big thanks to Charlie, to Jan and to Kate for sharing their account of COVID-19 with us. The other 2 gentlemen that you see in that video, one is Lee Halftek, who's an elite level rehab coach in international sport. But right the way across all levels, to be honest, through to everyday public as well. And Dr. Mick Malloy, who specialises in disaster medicine. I'm going to pass over to Carl to kick us off on the start of the FAQs. In this category, which was considering returning to exercise, we pulled out the top FAQs that came back from you guys and from others, to be honest, since the UK Active call 10 days ago. So, Carl, well, just to preface that as well, guys, what we thought would potentially be most useful to you is to answer this question in kind of 2 ways. You guys, for the most part, especially if you're face to face with clients frequently, you're going to be asked these questions directly. So where possible, we'll provide as a director response that you could deliver in the moment to those sorts of questions. But then Carl will also have some discussion around kind of under the hood for you to be able to deliver those answers in a confident and informed way, other areas that you will need to maybe want to focus on or read around. So Carl, first question is, when is the right time to return to gym-based exercise when recovering from COVID-19?
Yeah, thanks, Mel. And there's definitely 2 sides to this, and in reality, I'd be happy to have debates around this, but essentially we've got to look at this as to, if we're being asked that as a practitioner, the response we give, and then what really should be informing our thinking behind the scenes as to what we're actually going to do about it. So if a person rings up or touches base for us and says, I've had COVID-19, when is the right time to check? We need to just go through the basics first. So when was their last symptom, how long since they were symptomatic. So really, since their last day of symptoms, they have to allow a good 14 days before they can even start to consider when they're going to start to return to gym-based exercise. Then what we need to be thinking is about, well, what was the severity of their symptoms? How long did they have those symptoms for? And we need to start opening up a consultation and a conversation with the person to get a specific insight to what their experience of COVID-19 has been and where they're at with the potential to restart. And that's why we've put together a document which you can access if you don't have it already. We're happy to share that with you, which informs that initial consultation. So the questions to be asked and to go over and to be considered to get the right information from the individual. I would, wherever possible, you want to conduct that consultation in, either in person, over Zoom, confidential, allow time for it. This is the opportunity to build up something of a relationship. And really what we're looking for is this someone who is now coming to exercise because they've had COVID-19 and they didn't exercise before? Or is it someone who has an exercise experience and background like the people in that video? And what we're looking for is mixed within all that information they can give us is what's the soonest time. What we're trying to work towards is what is the earliest time we can get this person to start, to engage and start to change those circumstances and bring it round. And as long as we're prescribing that at the safest possible rate, then it couldn't come soon enough. But at the same time, we've got to make sure we stick to those fundamental principles of 14 days since their last symptom, and then capturing all that information. So the response to them, I would argue, is literally, when were you last symptomatic? How many days in between? What were your levels of physical activity and exercise like prior to COVID-19? Let's get into a consultation, find out more information so that we can set a start date. And that now goes straight into, if you don't mind me jumping ahead, Mel, that goes into the how often should I exercise and for how long? Because what we need to do is get back to some brass tacks fundamentals of best practice, which is whereby we're not going to guess anything, we're going to assess. If we're not assessing, we're guessing. So we need to bring in, as well as our consultation that's going to give us a situational analysis and give us a background as to what this person is coming to us from, we need to go in and measure things. We need to measure exercise tolerance, lungs and heart. We need to look at what they, what they can cope with reasonably. And we've selected 3 tests, one that are verified through the research, literature and practice, that are reliable, repeatable and valid with regards to the information they give us. So we've got our exercise tolerance test, which can be adapted to cater for the individual. So if someone is coming to us who's had no exercise history whatsoever and quite severe symptoms, we can still bring in about a version of the exercise tolerance test so we can get something of a level of their tolerance, and some indication of their heart rate response, because that is our primary indicator. Along with that, we put together a very simple to use and easy to administer functional assessment, and likewise a strength assessment. So we can take our typical 3-dimensional approach of assessing where a person is at with regards to their physical capacity and ability, and also their exercise tolerance. So the question to how often should I exercise and for how long comes off the back of gleaming this information. Once we are empowered to know through objective markers, these tests, going through those questions on the sheet, and then our subjective insights, which is based on the conversations that we have and those bits of information we can glean about the individual, then we can start to advise how much to do and how often we're going to do it. And the word from the start, I promise you now, you're going to hear this absolutely everywhere, is that we're going to constantly work beneath the ceiling. So whereas typically with some of our clients and individuals, we work at ceiling level, that upper limit of what a person's capable of, and every now and then we break through the ceiling to bring in a bigger stress and stimulus. No matter who they are, elite all the way through to someone who's never done any exercise, we stay beneath the ceiling, because one, we're finding out new things every day, and two, the important thing to remember is that in the wake of COVID-19, a person has undergone physiological change. There will be damage, for want of a better word, at a cellular level. So we're seeing damage on the lung, we're seeing damage with regards to the blood's oxygen carrying potential, we're seeing neurological issues, the more and more of the issues that are becoming manifest and revealing themselves over time, and all of that goes headlong into what we call post-viral fatigue or chronic fatigue, which in itself is a condition. So the way to deal with that is to work with fatigue and not against it. So we work under the ceiling. So everything we start to prescribe is going to be, what's the smallest meaningful change? What's the least I can do to start to build up this person's exercise tolerance and ability, never crossing that threshold? It's going to take time.
As Cole said, we were talking about this a little bit earlier, and as Cole said, somebody who might be accustomed to, for argument's sake, a 20-minute workout, if at the moment, as you've seen, say from Jan's experience in the video, Jan's had some days where walking to the top of the stairs has wiped her out. So if someone can't manage 2 to 3 minutes of exercise from a sort of a cardiovascular tolerance perspective, then certainly we wouldn't be prescribing them 20 minutes of exercise. So obviously I'm preaching to the converted in terms of the audience we've got here, but that's why, say for example, from a best practice perspective, as Cole's explained, we've selected those 3 areas to test in to give us a 3D look at what their start line looks like. Also,
though, further to that, Mel, it's about saying, well, if their exercise tolerance, so if their heart rate and their aerobic capacity is just low, and we know that that's going to take time, but our functional assessment shows that they're able to create some movement, but more specifically, there's an opportunity to improve movement. Well, we can maybe start some of our attention on the structure, the mechanics of it. We can start to prescribe exercise that's movement based, but staying away from those levels of stress. So we start to facilitate engagement, and we start to get people into the practice of working on their fitness, even though the specific context that it is in isn't the one that's going to tax the cardiorespiratory system to begin with. We'll start to build that up gradually over time. We can start to put more of a focus on the other 2 dimensions, or certainly that 1 dimension, as a means to get this off the ground. Because with regards to facilitating behavior change and compliance, what we don't want them to do is go off and get lost. Because if we put people back too far, similar to people who are overcoming cancer, similar to people who've dealt with type 2 diabetes, we're going to see the same statistics, is that they try to engage with fitness. Because they can't start there and then, they get put on a waiting list, for want of a better word, and most of them never come back because their fatigue takes over. It was a negative experience. What we need to do is be able to empower something of a start point from the start and build up relationships with those individuals that puts them at the center of the attention with regards to their progression.
A last thought I had as well when you were talking before was in terms of administering the tests. What we've tried to do when we've chosen tests this end is made them so that they're easy to do either in the gym or also outdoors, dependent on what restrictions are still being applied by government or the facility within which people work. So, and that's quite easy to do. As Cole says thousands of times over, you don't always need hundreds of thousands of testing and lab kit to get some of these simple tests to get you started. So that's also a useful consideration. Okay, next question, which we've been asked loads. Should I wear a mask when exercising?
The simple answer is no. It's a fair enough question to ask, because we know the fact that if we've got 2 people in proximity and they've both got a mask on, that's when the control of infection is most effective. But the mask itself, given the nature of the demand that's on the body and the increased breathing rate, is a barrier, and it's not practical to wear it in those circumstances. So what I would encourage is that the individual who's exercising doesn't, but we do need to seriously think about ourselves as coaching. I think the face shields lend themselves better because then we don't interfere with communication. People can still, read our lips. If they can't hear us fully, we can still be seen, and our facial expression can be seen. We've got to be pretty strict, really strict, over the 2 meter physical distancing room. So as long as we put these things in place, then, and along with our sanitization procedures and cleanliness procedures, then we can stick to that and we can control the environment as best as possible. But the short-term answer is no. However, if your exercise prescription starts with physical activity and you're engaging and supporting someone to increase in their walking outdoors, then absolutely, in those instances, I would encourage you both to wear a mask.
Okay, exercise effects. Why do I find the level or types of exercises I used to do easily so challenging or simply way beyond my ability now?
Okay, right, folks, where to begin and end on this? So just for those who maybe don't know, I've spent the past near 20 years immersed in research around fatigue, and fatigue is multifaceted, and look at it as from everything from someone who's tried to run a 100-meter sprint to someone who's getting off a hospital bed. So why does someone's level of type of exercise used to do easily challenging simply way beyond their ability? Because things have changed. Our first approach in these instances, well, normally our approach is to optimize a person's current situation. We all know that. You're all coaches or you work in the industry. The first thing we do when a person walks into the gym is we actually optimize what they're currently capable of. And they're the first wins that we see. So we make the system work better, and then we extend the system. So we start to build fitness up. Those early wins are great because people feel like they're getting fitter when actually they're becoming more efficient and they're using what they've already got. And then we extend that and we get them fitter. In the wake of COVID-19, as with any kind of chronic disease condition, and certainly anything that's related to fatigue, the first thing that we do is we restore the system. The system is not the same. A lot of medical practitioners are really cautious and reluctant to use the word damage because psychologically that can really prompt and inspire negative thought patterns amongst clients and patients with regards to what they're undergoing. But I can't think of a better word. The fact is that there is damage. There is damage to the lung. There is damage, again, there's cardiovascular issues. There's damage to nervous tissue. We've got to restore the system first. So when we start to judge ourselves on what we did before, we're not the same person. Right now, we need to repair. We need to make good. Then we need to optimize. And then we need to extend. And if we think of that, if that's our train of thought, with regards to our exercise prescription model, working with someone who's had COVID-19, then we can take care of everyone. We restore to optimize to extend, whereas our people previously, we've optimized and extended. So we've got to build in that restore. The reason why they can't is it's not just about efficiency within the lung. It's the fact that the lung, the alveoli, have been damaged. And friends of mine, colleagues of mine at, I won't name the places because they wouldn't thank me, but high performance institutes across the world, particularly in the US, have had a particular issue crop up with some of their highest performing athletes who actually had low symptoms, short duration COVID-19, and started to reintegrate into training pretty well and have just plateaued and they're not performing particularly well. They've hit these kind of glass ceilings. So they went to the extent of scanning them all. And under scans, they started to notice that there was damage around the alveoli and there was damage at the lung. So even with those low-level symptoms amongst these elite populations, we are seeing structural damage. So we need to restore that. We've got to make that good, then optimize, then extend. So the way we have to explain that to our clients is that we are first of all going through a rehabilitation and restoration phase. Let's repair everything and get you back to being 100% intact, and then we'll start to move forward on building new levels of fitness.
Okay, kicking on, breathlessness. You could argue that we've kind of covered this a little bit, Cole, but I'll let you make that call. Can structured exercise help or make fatigue worse?
So structured exercise can help as long as we structure the exercise intelligently, meaningfully, and we don't stretch people beyond that ceiling that we keep talking about. We need to really take the slow road and underscore and build up exercise tolerance over time. If we are prescribing this the right way, then the exercise stress will only act as a positive stress. So we need to think of our recovery time and our recovery strategies. But if we let people get carried away, or we start to push beyond that, we start to stretch beyond that threshold, then the exercise stress, in the circumstances of post-viral fatigue in particular, acts only as a negative stress. We increase levels of cortisol, we put someone in an enhanced inflamed state, and we are going to make a bad situation worse. So with regards to helping someone, this is what I said earlier on, you've got to work with fatigue and not against it. So what we've got to do is we've got to recognize that we've got this rock that needs to be moved, but we're going to go in the way that momentum and gravity help us along. So we're going to work just beneath it. We're going to move the surface around it so the rock moves, and we're not having to push and charge. So it's about whatever you think a person's upper limit will be, take about 15 to 20% off it. And to begin with, for some people, that's actually going to be quite taxing. You know, I've found that with direct experience of managing somebody through this process now. And for others who've got a real background in exercise training, the temptation for them is going to be, this isn't how exercise is meant to feel. It should be harder. I should be doing more. And our task in those circumstances is to realign and manage those expectations and encourage them, support them to rein in that in, staying beneath, and in that way, preserving the exercise as a positive stress alone. It'll only make it better in those circumstances. And I promise you all, conversations I have with medical colleagues of mine, clinical colleagues of mine, the worry they have at the moment is that the fitness and health industry is going to take these people and push them too hard. And what they're going to get are readmission after readmission, because those people are being further fatigued and debilitated. That's their concern. I promise you, from GPs to consultants, physiotherapists, their concern is we're going to push people too hard. What we've got to do is stick to that principle that exercise is only implemented as a positive stress.
Okay, doke. Motivate on that note, kind of similarly tied in. How do I stay motivated to exercise for what may be a very long road?
Well, I like this question. I was glad this one came up, because motivation, as everyone on this call knows, motivation is a fraud. If we only did things when we were motivated, we wouldn't do very much. We need to be disciplined, dedicated. We need to have a value attached to something that outstrips motivation. And where do we fit in the puzzle? Well, that comes down to us. If we build a relationship, if we bring about such a positive influence in a person's day, week, month, that they want to re-engage with us, that they know they're in safe and capable and informed hands, and that we empower them, we're the factor that empowers them to improve, then we're the motivation. That's about us delivering what we do. And I'm not going to patronize anyone, because this is what you guys do. So I'm not going to patronize you, but it's about being true to that. And also, I would say, as someone who deals with patients and clients, don't treat them like patients, treat them like clients. Give them that identity, support them, motivate them, guide them, reassure them, and make every session positive, because people get addicted to success. The reason why, let's talk about the elephant in the room. Why have we got this situation? Why are so many people in the UK, Western industrialized nations, at risk? Why? Because the fitness industry is not that attractive. we stick to around about 12 to 14% of the population at any time. So 86 to 88% of the population aren't interested in us. And why? Because they perceive it as being too tough, too cult-like, too demanding, too hard. You know, what we've got to do is win those hearts and minds and give them a different experience. And rather than show them what they can't do, we need to start from session one showing them what they can do and start to breed the confidence that comes off the back of new success. So it's all those factors, and that's down to us. That's down to the relationships we build from that initial consultation towards how we monitor and assess people, prescribe that activity, and how we deliver each session, and our ownership of that. Whether it starts off, it's a 5-minute walk around someone's garden with them as a PT, we might feel like we're being fraudulent. But what we bring to that with our mentality and our drive has to be the same as what we will put into those sessions in 2 months, 4 months, 6 months, when we're pushing them towards achieving something brand new in the gym that's far more akin to what we're familiar with. So that motivation factor that's in our hands. We own that situation.
Without wanting to speak to the smaller percentage of the converted audience based on what Cole just shared there, but one thing that is definitely clear is if somebody's returning to the exercise who's highly motivated, has had a long-term or very committed relationship to exercise, on the flip side of that, the challenge for the coach is going to be preventing them from doing too much too soon. Anybody that, and obviously Cole's spoken to dozens more than I have, but anybody that we've spoken to that is recovering from COVID, well, you heard Jan say before, they're itching to get back to exercise, but without the proper guidance, they may be overreaching or creating further harm. So it's kind of a fine balance dependent on the group with whom we're working with as to how we dictate the pace. Okay, so what other things can I do? Well, this one's quite a broad question, of course. So what other things can I do to best support my gym-based exercise recovery? I don't know your thoughts, Cole, but I don't know if you want to hone on just one or two things like diet or psychology, your call.
Yeah, I mean, there's lots, isn't there? So it always falls on us. It's expected of us to be somewhat up to date and informed when it comes to diet. And I agree, actually. I think because, as we know, you can't out-train a bad diet. Nice little cliche there, but we can't. And we are what we eat. So I think being able to encourage people towards better food choices with regards to, you know, the epigenetic benefits of certain types of food versus others, changing that narrative and being confident about it and being able to stand by quite strong messages and statements. Sleep is the key to everything. I'm a chronobiologist. My PhD was in time and day variation and the impact of sleep or a lack of sleep, and I've done X amount of studies. And if you're really inclined, if you Google Scholar My Name, you'll find a load of sleep studies. Sleep is vital. Sleep is where the body remolds. It's where it compartmentalizes new information. Neurologically, we reset and we lay down the myelin so the body learns behaviors. So we've got to be starting to have conversations with people about their sleep behavior, particularly around fatigue, because the temptation can be for them to take multiple naps in the day, which then disturbs their sleep of a nighttime. So they start to go in a downward spiral of fatigue. We need to break that. We need to have those conversations and encourage them towards trying to preserve those waking hours, those light hours as daytime hours and not napping, to force a better sleep regime back on. It's always good, wherever you work, wherever your gym is to know who you can signpost to. What support groups are in your area, know them on first name basis. Again, I apologize if I'm patronizing anyone here. It's just brass tacks and basics, knowing who we can signpost to. And particularly one of the best things I've found over the last quarter of a century that I've been doing this is knowing who your go-to psychologist is. Who are you confident? A bit like having a go-to physiotherapist. Who are you confident in referring someone to get really good, workable, usable strategies that will empower them to make a change and then move on? Not so that they're taking up someone's time on a couch once a week for the rest of their lives, that's not an effective psychologist. It should be where they're given the skills to move on. So it's about building that kind of network around you as a practitioner and knowing that. But I think with regards to diet, sleep, we should own that. We should be prepared to upskill, give that advice, and help them to manage those situations.
If a client asked us that question outright, obviously that's not a question that you can answer with a couple of sentences. That's like a 360 approach to working with a client. How might you respond to that as like an initial direct response that then feeds into potentially a new way of thinking? Do you know what I mean?
Yeah, straight away, because sleep is the restorative component of the day. My first question would be, what's your sleep behavior like? How would you rate your sleep quality? So I'd ask them that, and then straight off the bat, I would go, and what's your food like? You know, give me some of your thoughts on your diet, how you eat, where we are with that. And I would look for things for, certainly with regards to diet, my philosophy is start off by trying to identify some easy wins. And easy wins are typically what you can add to a diet rather than take out, and start to build an inroad on facilitating a really meaningful change in that area. But straight away, sleep. You can be the best exerciser on the planet. If you don't sleep, you're not restoring, you're not recovering, you're not remodeling effectively. That's where the compromise is. And a compromise to sleep brings about a factor of fatigue all of its own anyway. So you've got fatigue in the wake of the virus, and then we've got a factor of fatigue related to compromised sleep. So we've got a double whammy. Start with sleep, straight into nutrition, and see how much you can improve within your own skill set.
Awesome, thank you. Righto. For the remaining time, and just as a heads up, we're not in a huge rush to get off the phone. So if people aren't in a big rush to go at 4, we're happy to stay online and answer quite a few questions. I will get rid of this screen and make sure that everybody who wants to speak is able to. Does anybody have any additional questions or would like to delve into much of what we just talked about? Equally, feedback on some of the pieces that we did talk about, that is also welcome. So hit us up if anybody has anything.
I have one on on the mask that we were talking about earlier on there. So generally with any of my clients come in to the gym, I've said that WHO recommends not to wear masks. But if they want to wear one, it's entirely up to them, and I supply them. So most of my clients have said no, they're happy enough. However, what I do promote, and maybe I'm right, maybe I'm not right there, when we come into very close contact, because my clients are one-on-one, it's only me and them in the studio, there's certain exercises where you spot them, especially the bench press. Bench press is one, you're leaning over them. So I promote both of us wearing a mask. Good or not so good?
You know, I'm going to be really lame now, Chris.
Mm-hmm.
I'm going to give you one of those weak answers. It's different because you're working so specifically on a one-to-one. I would say if you can make that work, stick with it, because that is the best way to control the potential risk of infection for you and for them. So because that's so one-to-one, you can embed that as a principle because you're right there and managing it. And let's be honest, if that person was really going for a bit of a lift and you felt that the mask was providing a barrier to them, you know, breathing inefficiently, then you've got your mask on, they can take theirs off for a rep or two, and it's a managed environment. So I think because of the terms you're doing that on, Chris, that's fine. I think where it becomes harder is when you're looking at people who are attending a facility or a gym en masse and in numbers, and you're trying to control that. That in those instances, it's better to have a rule that governs. If people want to wear a mask, that's entirely up to them. I think what we need to be careful of is that the risk associated with wearing it when we can't manage it is greater than the risk otherwise. So I think what you're doing is great, mate. You're managing that very specifically one-on-one, and if you're both comfortable with it, then that's fine.
That's great, thank you.
Awesome. Anybody else got any questions?
Yeah, Mel, hi, Lyndon.
Hello.
How's it going? Carl, nice to meet you. Yeah, cracking presentation, extremely informative, so thank you for that.
Thank you.
Yeah, I'm sure there's plenty of questions and detail you want to come up with over the next crikey year, as you've said. I think this is with us for a fair period. But just going on the nutrition factor, I've got a couple of questions, but I'll just go one to start with. Supplementation, do you recommend, obviously, we always say it's best to get a balanced diet, but do you recommend certain supplements to improve the immune system? Because obviously the whole point behind exercise guidelines is to strengthen our immune systems. Are there supplements like you see now, these full greens and all this kind of stuff? Is there anything you would recommend that would bolster people's diets that would be essential at this stage?
Yeah, thanks for that question, Lyndon. That's a great question. So historically, I've always been a food first person. I've always talked to people about changing their diet. But the one supplement I've always encouraged, particularly in the UK, is for people to supplement with vitamin D, vitamin D3, because we don't get enough exposure to sunlight, and when we do, we're not exposed enough, and we typically don't get enough of it in the diet. And when we have a look at the impact of vitamin D3, its prevalence with regards to bolstering the immune system, and when we see incidents of not just COVID-19, although it's occurred in COVID-19, when we look across the spectrum of disease and illness, we see a direct correlation between vitamin D deficiency and increased risk of chronic disease, chronic illness, and it's been true of COVID-19. So there was a recent report just from North America that said that 96% of the confirmed cases who had the worst symptoms were also identified as having vitamin D deficiency. So can only encourage that, like fully encourage that. Try and look for a good quality one. The other one to consider, which is a huge issue in Western industrialized nations, a huge issue in the UK, Ireland, North America, is the fact that we have a poor ratio of omega-6 and 3. So we get loads of omega-6 and we get insufficient levels of omega-3, particularly as omega-3 itself, there's 3 key parts to it. So whereas things like walnuts, chia seeds, flax seeds, they give us the ALA, they give us the one type of omega-3. We need the fatty fish, the sea algae omega-3, which has got the DHA and stuff in it, to give us the other parts. And that really brings about a optimal cellular ratio for cellular health with regards to nutrition in and toxins out. And if we're compromised at a cellular level, then we are compromised. So the problem with that is getting a good source of it. And what I would encourage you to have a look at is forget the fish oil company, because that's dead in the water. Go and have a look at these companies who are out there now, who are like manufacturing and providing omega-3 supplements that are more aligned to how we get it from nature. So off the top of my head,
Colin, are you allowed to endorse which brands you can recommend? Or I know you're saying resource one yourself, but you must know which ones are good and which ones are shit, in all due respect.
Yeah, I'm reluctant to. I'm going to be honest with you. There are a couple.
There's only a few of us on the call, mate.
Yeah, you've got a good one, which is just around omega-3. So that's the Vitabiotic one. There's a company called Nothing Fishy who do a sea algae derived one that you can get, which is really good, because the key thing is if the omega-3 is attached to a polyphenol, then the omega-3 has a chance to do what it needs to do.
Sorry to be on the spot. I just think it's this is invaluable information that everyone should know. Because another question, Mel, if I can ask a second question, which is,
and good, as Paul said, good question first up as well, because we've been asked that about vitamin D quite a lot, so that's like a popular question. So sure, sorry, go ahead.
Even with people getting more out, because obviously before, I mean, crikey, the city's shut down, without being too morbid about it. But I mean, obviously now there's a lot more people getting outdoor exercise because they're going for walks, and just where I live, which is Bath, where there's a lot more people you see out and about walking, doing it, so they are getting outside more. But obviously, in the UK, that's still not enough vitamin D, no?
That's right. Yeah, it isn't. I mean, I you know, I hate doing anecdotal stuff. Bear with me, if you don't mind, gents. Like, compared to the average person, I spend an excessive amount of time in the outdoors, whether that's running, cycling, hills, mountains, the whole time. And I still top up with vitamin D3.
And do you do it based on body weight, or again, based for everybody?
Yeah, you do it based on body weight, but there's an upper limit with vitamin D.
Yeah, because otherwise you would piss it out, wouldn't you?
And do be mindful of that as well. Do be mindful of that. It's always written large across any kind of product you get. But I wouldn't worry too much. If you're getting vitamin D from your diet, your leafy greens, those kind of stuff, it's still probably not enough, genuinely, because of intense agriculture, aquaculture. So a little bit of a supplement goes a long way. And just start off low and build it up, and recommend that to your clients as well. But those two, you know, the more and more we look at the state of health and what we can bring about dramatic change of health, those two key with regards to supplements. I would argue anything else with regards to increasing your profile of free radicals and bits, you can get that in your diet quite easy. Those two are the two that are difficult to get into the diet.
Okay, thank you. There is another question, Mel, but I don't want to hog the space.
Oh, go on, go for it.
Yeah, the second one is more about its expiration rates. And obviously, the harder you train, the more force the air is exhaled.
Yeah.
So therefore, you know, there's facts and figures that come out with regard to how far you want to throw your spit, so to speak, or throw your breath. And so, I mean, is that, you know, there's facts and figures now, which some, you know, if you're exercising to a very high intensity, you can actually throw your breath, so to speak, or your vapor on your breath over 50 feet. Is there any truth in that? Is it scare tactics, or is it? I mean, this is obviously where the mask comes in because it keeps it in. But you know, is that over to you?
It's a very timely question though, because currently, along with the disaster medic that you saw in that video, Mick Malloy, who's based out of Harvard, him and I are currently working on a research project for the World Health Organization, and we are measuring that. That's exactly what we're working on, that they've commissioned us to do. Right. So what we're looking at is what's the reality of that, because there is a lot of scaremongering going about it. 50 foot is one of these things that's come into it, that if the environmental conditions were in an exact specific alignment and your trajectory matched that, then that's kind of a worst case scenario. In reality though, if you're out and about, and let's say for instance you're going for a jog, I would say triple what we currently advise. So if it's 2 meters, I'd say in reality you're looking at 6 meters.
Okay, thank you.
We've got a lot of work to do, and we're working, this project's live on the desk at the moment. But I would say if you're working towards that, tripling the existing guidelines, then you're somewhere right. And also remember, you know, if you won't be working with someone like that if they are still symptomatic and therefore potentially likely to infect someone else. And I guess the risk is if you're around, it's very unlikely, given how the condition works, that anyone dealing with the symptoms is going to be in that position and likely to infect us. So good question.
Thank you.
Guys, I would love to stay on, but I've really got to go. But it's been great chatting to you, and I've got a lot of info from it. Thank you.
Great, thanks for joining us, Chris.
Bye.
Any more questions? Otherwise, we'll let you good people get on with your afternoons. If of course you have any afterthoughts, then I'll make sure that you guys have got our email so that you can reach out afterwards. But other than that, we'll bid everyone a lovely day.
Mel, just
thanks for your time, folks.
Where can I? Sorry, I was late to the party. Where do I
Steve?
access? No, it's David.
Oh, you sounded completely different.
Where can I access the recording from?
I will send you a copy.
Okay, cheers.
No worries.
Thank you, Cole. That was really really informative from what I saw from the last 20 minutes.
Brilliant. Thank you. Thanks, David. Thanks very much. I'm glad it was useful.
Sweet. Okay, guys. Take care. Please shout if you need anything else.
Thanks, folks.